Hey everybody, welcome. It's Dr. Brown from KNS Chiropractic, your Baltimore area chiropractor. Today we're here with Shayna, and Shayna's been suffering from TMJ. We started treating her a little while ago. Let me tell you she'll tell you her situation and what's going on. Hopefully you can hear me. We're wearing these masks because of coronavirus.
I had to get a root canal and they put a dam in my mouth, and I had to hold my jaw a certain way for like an hour, and after that it was very hard to move my jaw, open my mouth, sleep. It was in pain when I would wake up, talk, everything.
So we've been treating her for the last probably going on 3 weeks now. She's had maybe like 4 treatments, and her jaw is 99% better. This will be her last treatment here for this. But in the beginning, I should have taken a video. She couldn't even open her mouth. She tried, and she just couldn't do it. It got very tight, especially, which side was worse?
This side.
Especially on the left side. So let me just explain to you, give you just a quick idea of how the jaw works. And you have this, your skull bone, which comes down here, and then you have your jawbone, your mandible, which attaches here. So there's an attachment point in here. And your jaw kind of should glide like this. Really nice and easy in this joint. Sitting in between here is a little disc. A disc is a piece of cartilage, and it makes it so these two bones don't rub on top of one another. And this has to track straight. Now on her, that right side of her jaw was tight. So what it was doing, it was taking, when she'd open, it would pull it off to the side. Can you see that, Meg? So it would come up here, and it would pull it off. Well, if it comes up here and it pulls it out of this groove here, it starts to irritate that disc and irritate the ligaments and the muscles that attach in that area. It creates an inflammatory reaction. The muscle gets tight, and this vicious cycle starts with pain and restricted movement and that type of thing. So what we've been doing is we've been adjusting this and using an instrument to get her jaw back in place. We've been doing electrical stim, and we've done some manual therapy on here. So unfortunately, she doesn't need a ton of that right now. Well, not unfortunately because I can't show you, but she already had electrical stim. We did some ultrasound. The electrical stim relaxes the muscle. The ultrasound reduces the inflammation, increases tissue healing, and the manual therapy that I was doing, rubbing in here, was helping to break it up. She really doesn't have anything there anymore. But what I was doing is I was getting in here with my fingers and working this tissue against resistance and trying to break some of this abnormal muscle tightness up. So what I'm going to just show you now is how we adjusted with this instrument, because it was tracking funny, just a teeny bit. It might even be hard for you to see. We can show you on video. I don't know if it's going to show up, but I know it pulls to that right side. So we're going to adjust this in a couple different lines of drive to get this back in a position. And then we're going to adjust this, her neck. She was having some tightness from this upper cervical area here, which also has some attachments into the jaw. So Shayna, I don't know. Let's see. Show them. I don't know if your jaw is going to open. It'll probably going to look pretty straight to them.
All right.
So what we'll do is we'll have her open her jaw a few times.
Now?
Sure. Well, it's hard to see. I mean, I can see it a little bit. Do it a few times. I don't know if you can see the way it's pulling off to the side. Okay. It goes like this and off like this. So in the beginning when she was coming in, it was doing this, kind of like stair-stepping back and forth, which is what we don't like because that's too much shearing action on that joint. That'll create a lot of irritation. Now what it's doing is just kind of going over to that tight side a little bit. I'm just going to adjust it. We're going to see if we can straighten this out. So I already know how to adjust her because I know what's been working. So this is an instrument. This is an impulse adjuster, and this will help to push that jaw back into position. So we're going to adjust this right in here. Open your jaw a little bit. Open a little bit more. Okay, shut your jaw. Do it again. And we're right here on this jaw. We're just trying to gently nudge it over into place. And we're on some specific spots here that we know will help to get that into place. Do that again. Open it up. Good. Do it again. Good. And it's very hard for you to see because it's such a minimal amount. In the beginning, it was really pulling over. So it's straight right now. So what I'm going to do now, I'll just show you how I do a quick adjustment on her neck. And we will see how that goes.
So, down, face
yep,
down.
I'm going to have her lay face down. Hold on, Shayna. I wish there was more for me to show you guys on how to do that jaw, but I just want to show you the instrument that we use And I do have some other videos where I do go through a whole regimen of how we do specifically treat it. So we're going to adjust this upper cervical area. These muscles go into there, so this is very easy. Just relax your head. Good. And we're going to get this side too. Relax. Good. And those are the muscles that go up into the jaw. The nerves come out from that area, innervate the jaw. Okay, sit up for me.
Okay.
So look, that's our last treatment on her. The next person I'll do from start to finish, but she did really well. 4 treatments, she's done, and we will see how she does. She can call me if she has any problems, but I think she's pretty good. And we will see you in 2 weeks for another video. Everybody stay safe. Remember, pain is not a lifestyle, and have a good one.